Very much. So it was indeed a very nice presentation from Dr. Shahid Javed. Thank you very much, sir. And now I am coming to few practical points when we are treating the patients in the office. How are we going to actually incorporate our medical knowledge when we are actually addressing the face of any patient? Playing over here? It's not playing? It's not playing actually? Okay, thank you very much. So in our office, what we are doing is all the time we have to treat the patients and we have to beautify them. That is the core thing that is asked from any of the doctors who's working in the office and doing the aesthetic practice. So to do the best job and to deliver the best, we have to understand the beauty concept. That is very important. To understand beauty, we should understand that whatever we are doing in our home by doing a little bit of makeup, or whatever we are doing in the offices to treat a patient and to beautify the patient, we are actually improving the shape of the face. We are trying to have a slimmer face. We are trying to have better cheek volume. We are trying to have a better projected chin, and we are actually playing with the brow height, and we are playing with the lip size, making it prominent and making our nose look slimmer and better. So this is what we are doing at home as ladies, and this is what all the makeup artists are doing around the globe, and this is what as doctors we are doing in our offices. What we are doing is we are incorporating the knowledge which actually in 2011 was formulated by Arthur Swift and Remington Kay as the Magnificent Seven, which comes as 7 points in the face which can be changed and altered to beautify any lady. And this is what comes as the global attractiveness rule. All these faces from various parts of the world, they all appear beautiful. So actually, what is this? Why every face looks pretty, whether it's an African face or an Indian face or a face from the Far East? What is unique about the face? Why? It is because we see with our brains, we don't see with our eyes, we just look with our eyes. So the information is computed in the brain. What is computed in the brain is the harmony and proportion in any of the faces that we are seeing or looking at. And therefore, we are all unique in our features. Ethnicity is not a beauty parameter. In the past few years, there has been a lot of discussion going on around the world by various doctors, various aesthetic practitioners and plastic surgeons, and they were focusing that most of the trainers around the world, the trainers of toxins and fillers and threads, they come from the Western world. So what we are learning is from the Western doctors, and we are trying to use the same knowledge given to them by their part of the world in our society, in our world. So what is that we are trying to actually westernize an Asian face, which is absolutely wrong. We have to maintain the ethnicity and we have to maintain the beauty, we have to beautify within their ethnic origin. We don't have to westernize a face to make it look beautiful. So as Dr. Shahid Javed also told, the anatomy is the key, and when we are actually applying that knowledge, still anatomy is the key considering while treating any face with toxin, fillers or threads. And this is the topic is all about. So this is not the anatomy I'm talking about, that you just figure out that one is not having a leg. But this is the anatomy I'm talking about. We have to look closer on the skull, on the facial anatomy. So what is different? Can you see anything different in these two skulls? Can you find anything different? But if you look closer, you will find that there are differences in the nasal bone, in the zygoma, in the mouth and chin projection, in the jaw heaviness and the height of the skull. Let's have a look here. You see the difference in the skull height and especially the chin projection. You will appreciate that. And also the mandible is quite heavier in this side of the skull, whereas it's much slimmer in the European skull. And similarly, the nasal spine. So you really have to look in the minor details when you are treating a patient for aesthetic reasons. So what is the difference when we look at the anatomy? The bitemporal, bizygomatic and bigonial diameters are much wider in an Asian face. So Asian faces, they are shorter, but they are wider. Similarly, in AP view, you would see that the anterior projection is poor in the Asian faces compared to the Caucasian faces, and they have retarded frontal bone naturally. So this has to be kept in mind. Similarly, the maxilla is receded and the chin projection is poor, along with the changes in the nasal projection. So they have flatter mid-face, and they have little projection of the forehead, and they have large bulky mandible with poorly defined chin. So to beautify, we have to tailor the treatment. We cannot just learn something from Paris and apply it in Pakistan. Sorry, we cannot do that. We have to tailor the treatment according to the needs. How to achieve the beautified face? Let's have a look at few of the faces, few of the examples that I have taken from an article, and I have also incorporated my own patients in few of the examples. You have to look at the face and then find what you can do to make it look much more beautiful. The orange is actually the HA fillers. The yellow is the energy-based devices. The blue is the fillers like calcium hydroxylapatite, where you need real strength. And the dark blue is the toxin. So you just have to give a little filler and in the forehead and in the temple area to make it look better. You need a little volume in the mid-face, but not to make it wider, because already the face is broader. So you just have to bring the face out and project the cheeks a little forward. You have to project the chin a little bit and reduce the jawline to make her look even more beautiful. Another example is from another patient. You see now she has a better nasal bridge. You don't really have to do anything with the nose. The cheeks, they are even better. You just need a little anterior projection. You have to just do a little forehead and the temple filling and just reduce the jawline a little bit, not too much. So this picture I kept specially here because you see the forehead. I find the forehead quite normal for my area, from the area I belong to. But this is the Nicole Kidman forehead is light in few parts of the world. I don't believe that this forehead is appreciated in our part of the world. What do you think? Do you think that this forehead, the egg-shaped forehead, is appreciated in our part of the world? I find it really bossy. So this forehead is pretty much okay. If any of the patients come with this kind of a forehead, it's pretty much okay. We don't really need to give a lot of anterior projection here. So this is my patient. I would request not to take the picture of my patients, but you can take the picture of rest of the slides. You see that this beautiful lady, she was absolutely gorgeous, very nice eyes, straight nose, full lips. The only problem was with the jaw, with the heavy jaw. And she came to me for a filler. I simply said, you don't need a filler, but she was really forcing me to do a filler because that is what they only know. They only know filler or Botox. They would not know what exactly do they need. So what she needed was a little bit of the reduction in the masseter muscle. And in the next slide, you will find a really beautiful, very nicely defined jaw. Nothing was done for the cheek, nothing was done for the lip, an absolutely gorgeous girl. You can always do a little eye filling if really needed. Otherwise, you can just leave it like that for the next time. This picture will show you that the lady has very bad anterior projection of the face. All you need to do is a little anterior projection of the cheek and will do the job. So in case of the faces which are really not very broad, you can always play in the lateral cheek, but the faces which are already broader, you can only play in the mid cheek and you can only do a little anterior projection, not the lateral projection. So this is the slide showing you how you will be actually doing the anterior projection of the cheek and the chin. This is one of my patients, but she's not an Asian patient, so I'm just showing you or sharing the results that what I could do was, I could use a little more volume in the lateral part of the face and give her a better lift. And whereas if I was having an Asian face, a bulkier face, I could not use that much of volume. I used probably 6 or 7 syringes in her full face, but I could not use that much of a volume in an Asian face. In her case, I just did a little filling in the anterior part of the cheek, this part of the cheek, and projected it a little forward. So here was the volume placement. Similarly, for the chin area, this girl was young and she never needed anything other than a little chin projection, and this was the job done. And you see that she has a better jaw definition over here, and we can even do a little more filling to give a little better projection of the chin. For the infraorbital area, you can just do the filler Any patient who walks in your office, I believe 80 to 90% of the patient would be needing some treatment under the eye after 25 years of age. If they are coming for a filler treatment, they would be needing some improvement in the eye area, because that is the sore point in our faces. A little bit of filling in the medial part of the tear trough will do the job, but with the passage of time, since there is bony shrinkage, so you really need to put a little volume in the lateral part of the orbit as well. But in her case, I just put the volume in the medial part of the eye and give the very beautiful results. Regarding the nasal angle, I really don't do a lot of nasal treatment, nose treatments with the fillers, but just for the sake of discussion, I've kept these two slides, that the nasal angles, they can be improved with the help of fillers if somebody wants to get it done, and if you find your hands really safe, you can always do it. But really, I don't do it in my practice, and I've hardly done any nasal filling with the HA fillers. And I would rather like them to be done with some other hands who are in the practice, or maybe go for a rhinoplasty, surgical rhinoplasty. For the temple and the forehead filling, this is something that is very, very important, and we mostly just ignore temple filling and the forehead filling, and I find it really helpful in aging faces and even in the faces who are not really very aged. You see the lady, and she's having a very tired look in the eye area. I did not do any toxins over here. Can you see the hollowness in the middle part of the forehead? So it was just done with the help of a little filler in the temple area and in the forehead area, and the whole face, it just changed the look in her eyes, and she looks much relaxed and much better. So this was the volume placement in her case. Another patient from our office, you see that in this picture, you see that there is a lot of hollowing in the middle part of the forehead. Similarly, you see this line. You cannot treat this line with Botox excellently. You just can reduce the line a little bit, but this lateral part of the brow is really tricky. You cannot just do a little Botox and just get rid of the line, because it will alter the shape of the brow. So what I did was, a little volume was placed over here, a little volume was placed in the lateral part of the brow and the temple, and just the volume placement in the mid-face. Nothing was done for the nasolabial folds as such, because with age, everything is falling down, and I really never want to do a lot of volume filling in the lower part of the face in a little older age group. And you see that there is an excellent forehead approach. You see the line is gone, the line is, there's no more line, and the face is lifted, the nasolabial folds are gone, the marionettes are gone, and she has a much relaxed look on her face. So with it, I finish, and thank you all. These were just the tiny tricks according to the Asian faces. Thank you very much.
So one question, Dr. Armeela. You didn't tell us about double chin and deoxycholic acid. Can you please tell us a little bit about this deoxycholic acid and double chin as far as this Asian skin is concerned?
Thank you very much. So actually, with the double chin, it's a very important point that you have raised, but I really don't use the injectable lipolytic agents for the chin area, because I would rather prefer to go for a surgical procedure, and since I'm blessed that I have a plastic surgeon sitting next to the office, so I would just refer my patient to him instead of trying again and again. I have never used it in my life, and I have never tried it in my life. So radiofrequency or maybe surgery.
Dr. Harun, your experience as far as this deoxycholic acid is concerned, how are the results, and please let us know.
I really love this product. Being a physician.
Is it a result-oriented product?
Yes, it is.
Very result-oriented?
Very result-oriented. But you have